we have some West Coast states and some others across the country that are pushing to get their school face mask mandates lifted. What are your thoughts on where Washington stands on getting that lifted out of schools?
Like the entire 2 year pandemic, the data evolves, the evolution of this evolves. And in the beginning, it was such a critical measure for protection because we didn't have vaccines and we didn't have an understanding. As we've gotten higher vaccination rates, natural immunity rates, and a better sophistication about knowing how this impacts students, both from a health standpoint and then a mental health standpoint, it's time to make the evolution. It's time to make the change. So we're working every day with Department of Health and the governor's office on what they're thinking and what kind of science they want behind this, but we have encouraged them to think intensely about this. It is time to make the next transition in this pandemic, and that is likely a mask optional, but that isn't the decision I get to make, only an insight for the decision makers on this from the lens of schools, and our schools are ready to make this transition.
So you think we should move to a mask optional state? Could you talk about that? What that would look like if you were the one who were able to make the recommendation?
Yeah, again, I'd ground it in the science still. You have to. This can't be whipsawed because, there's a lot of emotion around it. Masks help. Masks collect droplets that otherwise are distributed in the air and onto surfaces and onto other folks. The question is, in the beginning, when you had no other mitigation strategies, you absolutely had to do that. Here we are now with the ability for everyone who's in our schools to be vaccinated. And if they choose not to, that's very unfortunate. But we have other strategies now. And so the downside of wearing masks, whether it's speech therapy or learning or that social interaction or the frustration or all the discipline of teachers asking kids to put them up or the community frustration, those variables didn't counter the health benefits in the beginning, but now with vaccination options, those variables become more important. So, what I keep saying to the governor's office and to DOH is, you are the experts at public health and you need to guide through this, but you said consistently that public health is more than case rates. It is mental health. It is community. It is that sense of learning ability for young people, that sense of hopefulness. So I think if they consider all those factors, they will make a transition sooner rather than later. And that's what we're encouraging them to examine.
All right. And if it were your recommendation, would you say, let's get rid of masks, or let's make them optional, let's move forward?
I would make them mask optional and let families make that decision at this point, with a really good public health and information campaign, that if a new variant comes along that's as deadly as the ones we've seen, there may be periods of time where we have to go back to it. And that's really hard for people to accept, but yeah.
How regularly are you in touch with the governor's office or the DOH on this particular topic, especially as of the last few days and today, because other states' governors are making this call?
Well, through the pandemic, we've been in touch with them almost daily through the whole pandemic, so it isn't new, our frequency, but it's daily. Sometimes it's 3 or 4 times a week, but almost daily, one or the other, governor's office or DOH. This isn't new. This topic we've been talking about for quite some time.
Absolutely. And do you feel like you're hearing from a lot of district leaders that they want this, that they want the masks to be lifted?
Yeah, there's been a steady beat of that for a long time. And again, I disagreed with them when it was one of the only health mitigation strategies, and hospitalizations were going through the roof and we were losing lives at record rates. It was just an ignorant message for them to say masks shouldn't be worn in the beginning. Today, though, what they will tell you is, here's my vaccination rates, and here's my cases, and here's my ability to demonstrate the evidence that because of vaccines, natural immunity, and our ability to quickly identify symptomatic individuals, we can do this effectively now. And I concur with that. So more and more districts are telling us, when we weigh all things now, the balance of that decision should be on mask optional.
All right. Do you think you have an idea of a timeline of when that could potentially, come into the mix of, here's the plan and here's where we could launch it? Is that something we could see before the end of this school year?
Almost definitely. Everything we gather from DOH and the governor's office, because it really is a decision of health, is that I think they're on a similar line of thinking as, excuse me, these other states we've seen. So decision making in March or final decisions in March. So I think they're on a similar track as other states. They just pre-announced without a lot of detail. And as you know, in Washington, we're not likely to announce anything until we have a lot more detail.